Now, some help for you if you're having a problem holding your water. It's not something people like to talk about, but one international study suggests 13% of women and maybe 5% of men have urinary incontinence, and the numbers increase with age. Well, Dr. Geoffrey Kostiner joins me now, and he's here to talk about your options for treatment. Thanks for joining us. The basic definition, what is urinary incontinence?
Urinary incontinence is the involuntary or unwanted loss of urine, essentially. So not having control over your bladder.
And we're not talking about wetting the bed. We're talking about something that affects folks who, as we get older?
We're talking about adults, essentially. Generally, it occurs in over 40 years old, most commonly in women over 40. It affects men kind of later in life. Traditionally, there's two types of incontinence. There is urge incontinence, which is I can't make it to the bathroom in time, or hearing the running water and causing that to make you to go. Or the stress incontinence, which is generally treated with surgical procedures, simple outpatient surgical procedures.
Are some folks more at risk for this than others? For instance, a woman who has had children or a man with diabetes?
Absolutely. When I said women over 40, usually after having vaginal childbirth, post-menopausal women are especially at risk. Obesity can affect it, diabetes can affect it. These are all contributing factors.
Wow, it seems like folks with diabetes are getting hit all kinds of ways, and this is just one more complication as a result of that.
Absolutely.
Now let's talk about some solutions or treatment.
Traditionally, urge incontinence was treated with medication. So medications to calm the bladder down, and these medications have significant side effects, unfortunately, which causes a high discontinuation rate. Dry mouth, constipation are the main ones that cause people to stop. Older people, they have sometimes problems with mentation, meaning they're not as sharp, and sometimes they have blurry vision.
Wow. So you have to weigh the problem with the incontinence versus the side effects from the drug.
It's actually like with every medical problem that we treat.
And if you treat it that way, does that drug conflict with some other drugs folks may be taking, for instance, for diabetes?
It doesn't conflict with diabetic drugs, but there definitely are drug interactions with any drug we prescribe.
And now you mentioned a type of outpatient surgery.
Correct. For urgency, frequency, nocturia, urge incontinence, the worst type, there are outpatient procedures if people can't tolerate the medications. We have tibial nerve stimulation, which basically we stimulate a nerve in your leg that tells your bladder to calm down.
Wow.
There's also interstim, which is a neurostimulator type of procedure, which is done as an outpatient. It's been about 100,000 of these procedures done worldwide.
And folks can find out more about these procedures and the latest techniques by coming to a seminar coming up. Tell us about that very quickly.
Correct. We have a seminar coming up on September 27th at Mary Immaculate Hospital in Newport News at 6 p.m. And the number to call to register is 889-CARE because the spaces fill up.
That could be very helpful for some folks who are dealing with a very stressful problem right now, urinary incontinence. Dr. Geoffrey Kostiner, thank you very much for joining us.
Thank you for having me.
All right.